Can your Step to CK study resources keep up with the exam? Are you wondering if your study materials for the Step to Clinical Knowledge exam can keep pace with the demands of the test? Let's break down what you need to know. The Step to Clinical Knowledge exam evaluates your ability to apply clinical science knowledge in patient care. It covers essential areas like internal medicine, surgery, pediatrics, obstetrics and gynecology, psychiatry, and preventive medicine. This exam lasts 9 hours and is divided into 8 blocks, each lasting 60 minutes. You will face up to 40 multiple-choice questions in each block, focusing on clinical knowledge, diagnosis, and patient management. Given the exam's complexity, it is vital to have study resources that reflected the current standards and expectations. The United States Medical Licensing Examination Management Committee regularly reviews and updates the exam content. This ensures that the questions align with modern medical practices. For instance, in 2025, the passing standard increased from 214 to 218. This change reflects the evolving competencies expected from examinees. Because of these updates, your study resources must also be current. High-quality resources should incorporate the latest exam outlines, question formats, and clinical guidelines. Many popular question banks and review materials update their content annually or even more frequently. This is essential to keep up with changes like the increased passing score or shifts in focus on certain specialties. When assessing whether your study materials can keep up, consider a few key factors. First, look at the timeliness of updates. Resources that quickly adjust after official announcements will best align with current expectations. Next, ensure that your materials cover all core disciplines thoroughly. The quality of practice questions is also important. Resources that mimic the style and difficulty of the actual exam will help you prepare more effectively. Additionally, keep in mind that the discontinuation of the Step to Clinical Skills exam has shifted clinical skills assessments to medical schools. This change may influence how study resources approach clinical reasoning and patient interaction scenarios. From a medical school perspective, it's wise to choose study materials known for frequent updates. Faculty recommendations can guide you toward resources that align with the latest standards. Medical schools often provide lists of approved materials that reflected current exam content and format. To maximize your preparation, use a mix of updated resources, including question banks, review books, and clinical case simulations. Staying informed about official announcements from the United States Medical Licensing Examination regarding exam changes and scoring adjustments is also crucial. Incorporating clinical rotations and hands-on experiences will complement your knowledge from study materials. Remember, the Step to Clinical Knowledge exam emphasizes applied clinical knowledge. In summary, your Step to Clinical Knowledge study resources can keep up with the exam if they are regularly revised, cover all tested disciplines, and provide practice materials that simulate the exam's demands. Prioritize using dynamic resources to prepare effectively for the evolving Step to Clinical Knowledge exam.